Very commonly, when patients are nearing their very end of life, they may start to experience something that a hospice provider may call terminal secretions. Um, Terminal secretions can be kind of a scary word. It also can sound kind of audibly concerning and scary to people who are at the bedside as caregivers next to this patient as they are experiencing this symptom. One thing to really remember when terminal secretions are happening is 99% of the time they are not causing any distress to the patient themselves, which is a great source of relief for most of us once we learn that fact. What happens to the trachea and the esophagus when the body is relaxing in those final stages of life is, those muscles, the reflexes in those muscles are less sharp. So the ability to swallow secretions down into the gastrointestinal tract through the esophagus, or the ability to cough and clear them out through like the trachea and the epiglottis, those reflexes are less active. So what happens is that secretion still sits there and the air is moving through it, and it can make a very distressing sound. And so one of the things that a lot of families will ask for is, can you do something about that? Can you make that go away? Because it's really hard to hear, and it makes them worried that their loved one is, suffering or struggling to breathe. There are certain medications that can help dry out some of those secretions, but the research actually shows that those medications can cause sometimes more harm than they do good. It can make the mouth really dry, which then is another source of discomfort for the patient. And so really our preference is not to necessarily treat the secretion to make it go away. It's more to help accurately position the patient so that those secretions don't sit right in that esophagus, right at that trachea, right at those vocal cords and make that sound. So you may hear your hospice nurse or your hospice team talk about repositioning your loved one into a position where gravity can kind of help move those secretions away from that spot in the throat, and avoid that sound and avoid that fear that they might be choking. They're not choking, but I understand how distressing it can be to hear that noise. So you'll probably hear them talk about repositioning that person in a better position where those secretions may be able to roll forward, so we can clear them from the mouth instead of having them stationary and kind of sitting in that esophagus.